How will our providers get credit for promoting interoperability? And then he adds some context. We are a group practice using a certified EHR. Part of our practice is service of patients in extended care facilities. We were recently recruited by an ACO that is specializing in care in extended care facilities. For their model, our ECF providers have joined their extended care facility practice and bill their ECF work through that dedicated practice 10. For our group practice, we submit Promoting Interoperability for MIPS. Will our NPIs in the ECF-TIN get the home 10 score for PI in the ACO?
Great question, Tim. Kind of a special case that won't apply to a lot of you out there. For those who do and for similar situations, the answer is no. Medicare does not recognize the concept of NPI, that is not, at least not NPI alone, in the QPP program. Individual providers, in the eyes of the CMS QPP, are 10 NPIs. So an NPI is a different entity to CMS and the QP in each 10 that the NPI participates in, each tax ID number, that is. So the PI score developed in one 10 does not apply to the NPI in another 10. The provider is a separate entity in the eyes of CMS QPP in each 10 in which they bill. So the PI submission you make for your group will not count toward the work your provider does in the ACO ECF-TIN. That's the Accountable Care Organization, Extended Care Facility, Tax ID number. That is a unique business, and the NPI, the physician or provider, becomes a unique entity in that 10. The better news is, so long as the ACO ECF-TIN exclusively works in facilities, those providers have a valid exception to the need for a PI submission. They're even accepted from the progressing rules requiring ACO participants to use Certified EHR technology or CERT. Your providers don't, in fact, need to be exclusively in that ACO 10 working in extended care facilities. As long as at least 75% of their volume is in ECFs, it qualifies them for that facility-based exception. And it doesn't have to be the same ECF or even the same type of facility. Each 10 NPI who generates at least 75% of billing in any combination of facility, that includes extended care facilities, hospitals, or ambulatory surgical centers, should qualify for the exception. And the 10, so long as at least 75% of the 10 NPIs qualify for the exception, the 10 will qualify as a group for that facility-based exception. Now, Medicare should automatically identify that facility-based exception for each of the providers. And Medicare should automatically identify the facility exception for the ACO ECF-TIN. You can check that out on the QPP status tool available on qpp.cms.gov homepage. Status can be checked by individual NPI and by group TIN. Now, you should check your status, or the TIN they're participating in should check that status at the TIN level. If Medicare has not granted the facility-based exclusion or exception to the ACO ECF-TIN, you should, in the identity, or that TIN should, in the identity of the ACO ECF-TIN, apply for the hardship exception based on facility-based work. Well, kind of a focused question, very narrow application, but it should give you some more insight on how that exception is applied. Thanks, Tim.